Female genital mutilation is the ritual removal of some or all of a woman's external genitalia. It's practiced in mainly African countries as well as the Middle East. Sadly, the practice has been passed on to generations residing in the UK. The NHS estimates around 66,000 women are living with the consequences. The true figure is probably much higher, as FGM is not spoken about.
The reason FGM is not being discussed or talked about it is the topic is a taboo, it's a topic that everybody feels some degree of shame.
Most girls are cut before the age of 5, and in some cultures it's seen as a pathway to womanhood and is done during the teenage years. The World Health Organization classifies 4 different types of FGM, which range in severity.
There are some beliefs that if during labour the baby's head touches the clitoris, then the baby will die. So one way to get around that is to cut out the clitoris. I think a massive incentive for people to stop cutting their girls would be to educate the groups that perform FGM that actually it damages fertility. There's a greater risk that not only the mother but the baby will die.
Through education, through talking to friends, through understanding the medical side of things, helped me to make sure that I do not carry out this act.
Particularly in immigrant communities, it's not really something that's discussed by the men in the family, but certainly if the father figure of the family put his foot down and said, "I'm not going to have my daughters cut," then that could possibly have a really wide-ranging effect if enough men did that.
There are no known health benefits of FGM, yet a long list of complications that can arise. These include recurrent infections, chronic pain, cysts, the inability to conceive, childbirth complications, and fatal bleeding, not to mention psychological damage. We need to encourage all generations to discuss this practice before we move any closer to eradicating it.